We enter the skin a few millimeters below the skin projection of the caudate edge of the transverse process. Then, we slightly angulate the needle up to land on the transverse process. After landing on the transverse process and noticing the depth from the skin to the TP, we then advance the needle 1 centimeter deeper below the transverse process. The final trajectory of the needle should be close to a right angle with the skin. Here is an example of suboptimal trajectory. The entry of the needle was too high and angulation was too much. As a result, advancement of the needle 1 centimeter deeper than the depth of the transverse process did not get us into the paravertebral space. Therefore, we need to do secondary advancement. Occasionally, when angulation of the needle is even steeper, one may hit the rib or transverse process below. Needle entry point is a few millimeters below the skin projection of the caudate edge of TP, shown by the black dashed line. Red represents safe landing on TP. Purple represents advancement into TPVS after contact with TP. The final needle angle when the needle tip is in the TPVS, which is the purple dashed line, should be close to a right angle with the surface, or just slightly more caudate, about 10 to 20 degrees. After initial advancement, there is no loss of resistance. This probably occurred due to a suboptimal trajectory of needling. Note that the angle of the needle is significantly angled caudate. After noticing the depth of the needle at the skin, we start secondary advancement for 5 more millimeters or loss of resistance, whatever comes first. We split secondary advancement into 3 increments, 2, 2, and 1 millimeter, while checking for a loss of resistance after each increment. This is an inside view of secondary advancement.